Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
That's me.
That's him. That's him. And he's always looks so beautiful in his suits. And you know, when you go to the office,
You like my shirt?
I love your shirt. I love your
you.
tie. I love your
Thank
suit.
you.
I think it makes a difference when your patients see you in the morning, and that I've seen doctors that just don't look like
Bright
you.
eye, bushy tail.
That's right, right, and bushy tail, and looking good too.
When I used to make my rotation by the nursing home with the students. Okay, let's go and see our bright eye, bushy tail patients.
Oh, you've had such a wonderful spirit, Dr. Mencia. I think that's really, besides being so well educated and experienced, that's the spirit that people see from you. That's what I see.
What we call in Chinese, the spirit of the tiger.
The spirit of the tiger. I love that.
Rawr.
Yeah. Do you have a shirt that says that?
No,
I have to
no.
buy you a shirt. The spirit of the tiger. I have that. I'm going to get you a T-shirt.
With
Okay.
with a bling bling.
A bling bling. Oh my gosh. Okay. Now,
Neon sign.
Neon.
Ooh,
Woo.
the spirit of the tiger.
spirit of the tiger. Well,
So,
this subject we're going to talk about is kind of.
I don't know. Yeah,
right.
It's a nice subject. It's raining. People at home, they don't want to get up and take out the garbage or anything. So let's talk about losses.
Losses.
You
Yes.
know, and we were talking about in my training, I did a 2-year fellowship in geriatric, which makes me competent to do a chairmanship in a hospital and teaching program and stuff like that. And when I analyze the teaching program that we have, even today, it gives you a little taste of what hospice is, but it doesn't really prepare you. And that's not for geriatric, that's really for any age. It doesn't prepare you to handle and manage losses in your patients and in our service. For example, we know about death and dying, and we have spoke about that, and you have done numerous programs on death and dying. But I had a young guy in his mid-30s working. His son will come with him sometime. And sometimes when I see kids, I ask them, well, what are you going to be when you grow up? What you want to do? And sort of trying to inspire them.
I want to be like
son-
you, Dr. Mencia.
The son will come, and the son now he should be about 17, 18. And this guy just had a stroke, had a major stroke, the father. And, knowing the father and his girlfriend and his 2 kids, it touches you. So, of course, he can't work no more. He's disabled. So I have to go through the process of helping this guy that have lost part of his body, sensation and, helping fight through this. And, despite what the study in my past have shown, what the research have shown, is when what we call in Asian philosophy, mind over matter. So, I put on my taekwondo hat and take off my medical hat, and I, work with this guy, and I would squeeze his right-handed, and he lost the right side. And I would squeeze his right hand. I say, squeeze my finger, break my finger, come on, squeeze tight. And you see him try, and nothing will move. But he will try. You can see he's trying because you can see his forearm muscle are contracting. I say, I can't. I say, don't give me that stuff that you can. Look at your muscle over here. And he look at his forearm, and he see the muscle are moving. I say, oh my God, yeah, I still have something there. I say, yes, you have a lot. You have to retrain your brain, and you have to keep working whatever muscle is getting connection to your brain. Just keep working on that side. And he used to be brought by his girlfriend when this happened. So we put him on blood thinner and what have you, and blood pressure control, and all these things. And, he said to me, being so young, I remember I came to see you like 3 years ago, and you told me about my blood pressure, and you talked to me about a little touch of diabetes that I have and my cholesterol. And I really looked the other way. I said, I'm still young, still a life ahead of me. What the heck, just try to eat a little bit better. I said, Dr. Mencia, I did it for a few months. Then I just forgot all about it. And your office will call me, it's time for your yearly checkup. And I will give excuses and what have you, and look what happened to me. I said, that's okay, that's the past. Yeah, we have to forget about the negativity of the past. Because your past, everyone's past is going to have positive and negative. It's life. The present is going to have positive and negative. And what is positive for some person might be negative for other. Raining right now, some people see that as a negativity. Ask a farmer. He's so happy. He's tickle happy. He said, oh my God, it's raining. Thank God. Thank you, God, for this rain. I needed it so much. So, it's a lot of relativity on what we call what's positive and what's negative in life. And, you look at people that have macular degeneration and they lose their vision. It's a major loss. And we, a lot of time we just take it lightly. And, we have to spend time with those patients on what have proven to be effective, from the holistic point of view and the traditional point of view. What have proven to be effective? Well, if you have dry macular versus wet macular, where those aspirin is usable and it's not, fish oil, where it's usable, when it's not. And start doing your own research on what you have so that you can fight it with everything, And, I have one of my patients say, I got this treatment that is excellent to lower the cholesterol. I say, beautiful, let's try it. Don't stop your medication. Let's leave the medication where they are, and that's what we're going to call our baseline. So if your bad cholesterol is 98, this is going to be our baseline. And let's see where this regimen will take us. And we see the bad cholesterol drop to 60, then we pull back on the other cholesterol medication. If it stay at 98, it's not touching us. If it goes higher, it's doing harm. So you just take a baseline, but don't do things blindly, And that's why we have all this blood tests and everything. Loss of extremities. I have one of my patients that have an amputation, and usually, most of the amputation that we see is either below the knee or above the knee, which is great because then we can put a prosthesis there, to help you ambulate. And we had a show on prosthesis.
Did. We had a great show.
We had a great show. It was a lot of fun.
It looked so natural. I didn't even know it wasn't his own leg.
Right.
So things have changed. But you have to think about, I'm glad you brought that up. Talk about losses. So sure, they're out and they have their prosthesis, but then when they take it off at night or they have a new friend, there's got to be something in their mind. But what you said, the spirit, of the tiger, as long as you can somehow say, okay, so it is what it is, but I'm still...
You're still you, right.
Yeah.
You have to love yourself, right? You have to love yourself. You get yourself naked in front of a mirror and you look at yourself, and regardless what age have done to your body, be happy and grateful that you're still alive, which means that you can do so much for humanity, for people around you, your family, your dog, your cat.
That's
your
right.
horses.
That's right. That's true.
I miss my farm with the horses. I miss that. I love that. That was.
You also miss your dog. You don't have a dog.
I don't have a dog. I am the dog. When I get in front of the mirror,
You're the dog.
hey, I'm the dog now.
Oh my heavens! Right, you're I don't know what kind of a dog you are. I have to think about what kind of a dog you're.
I know.
Like
What kind of dog would I be?
No, well,
well,
you're like a.
let me see in
actually,
reincarnation what I would come back as.
Well, you're very sweet. You're very gentle. So it has to be a
maybe
nice.
I'd be like a chihuahua, a lap dog.
No, you're not a chihuahua.
A lap dog.
No, you're not that. More like a cocker spaniel. Maybe a dog that has beautiful hair and beautiful. I don't know. I'm not sure what kind of a dog you'd be, but
chubby.
You could
Not
be
chubby
mine.
Dog.
You could be mine anytime. I'll take care of you. I'll feed you. I'll give you water. You can sleep on my bed.
What did you say when you touch my shirt? I don't mean to be fresh.
This is getting.
Richard, he was touching my shirt. Richard is covering his eyes.
Oh my goodness. Okay, but let's just talk about losses because but that's good. Pet
Also,
losses. Pet losses.
Yeah.
I meet a lot of people who they've lost their pet, and they don't want to get another pet because they're suffering. And I always say, but there are other pets waiting to be loved.
Absolutely.
And we see this way. I just want to follow through with this.
And that, that's the main thing. Like people that have no kids, right? And pets is their life.
Absolutely.
That's their life. That's they
Right.
they look coming home to that. And the main difference is that when you have kids, you don't say, okay, let me go and have more kids now because I lost my child.
Right.
So it's an okay feeling to say you don't want to have any pet because you have to get over the loss. So it takes time for you to get over that loss. Go to that grief period.
Well,
of your life.
but
So it's okay, but then you need to snap out of it.
Right,
If
that's
it
right.
lasts too long, that means you have a problem, and you can be depressed. You can be depressed, and you might need treatment for that depression. You might need hypnotherapy that we have spoken about hypnotherapy. So if you don't want to take medication, but we need to get to the subconscious to help you understand. That dog is in dog heaven, or that cat, or that bird, or what have you.
or that horse.
Or that horse, it's in heaven, in animal heaven, let's call it.
Okay.
And it's time to move on and, share your love with another animal if that's what you like.
Okay, but how about someone who's been married for a long time and the person dies? One of them, of course, the partner dies. And I think now that people are able to find other people.
Yes.
It doesn't mean they're going to marry. It doesn't necessarily.
That's usually one of the questions we ask medical students. And a lot of times people get it wrong. We ask them, what would be the loss that will bring the most significant effect on the survivor? And we ask, is it the loss of a parent, the loss of a spouse, the loss of a child, etc.? And it's usually the loss of a spouse. People would think, I would think my child, or I would think my parent. When you lose your spouse, that the grieving period is much more prolonged, and it takes time.
And it could be from death or divorce.
It could be from death and divorce. And, divorce is a little bit different. You can overcome that much faster, Still a loss. They are all losses, Divorce is probably one of the worst ones because everybody loses. You have kids, you have animals, you have a house, you have friends,
Right, and the person's still there. They're divorced, and they're still living, but they're just not living there with you.
But it's a loss, and we have to see, a lot of people, I'm so happy I'm getting divorced, and that's the mask that people put on. Nobody's so happy about getting divorced. It's a loss. It's a loss. And sometimes, you just feel like a failure. Except some people that take it for lightly. Say, I've been married 15 times. So to that person,
I don't know anything
to that
there.
person, it's like, married today, divorced
Of
tomorrow,
course,
and married the next day, divorced the
That's
next.
not the same.
No, we're talking about the classical thing that we understand as a marriage. But that's, that is a loss, the loss of a business. A lot of people will put so much into a business. When I started my business, I came to Florida with this dream of how geriatric medicine and internal medicine should be practiced. And one of my dreams is to be able to start a teaching program. Now that I've been doing this for 20 years and I have proven how effective this could be, this system, be able to start a teaching program to bring future doctors to start learning this way of merger between homeopathic and traditional medicine, and bringing services together for the baby boomers and the geriatric patient. Because one of the things that we lose as we age is the freedom to move around the speed of light. And, when we age, we have to go and see the cardiologist, we have to see the urologist, we have to see the podiatrist, we have to see the eye doctor, we have to see the pulmonologist sometimes, the GI every so often.
Doesn't leave any time for adventure, does it?
Right. So how beautiful is to have a center where you have all these services, the main services, not all of them, because then it becomes another hospital.
Right.
But the main services floating through, and say, okay, this day you have these 3 specialists coming through, and that day you're going to have the other one. And the blood test, a lot of doctors, you go to a doctor, you don't make any money from drawing blood to send it to the lab. So they say, you know what, I'm not even drawing your blood. Just go to Quest or go to LabCorp or go to whoever, get your blood drawn over there, and I'll give you the paper of what kind of blood test I want. And then you get the report coming back to you in a computer.
Not
so,
good. Not good.
Why waste the time of drawing blood? And I say, you know what, I'm not going to send my patient to... And I had a young lady last Saturday. Oh, I want this specific test, and I want it like this. And I don't want your staff to mess that up, so I want you to give me the paper, and I want to go to, I think she went to Quest to have it done. I'm going to go to Quest, I'm going to have it done. And I said, sure, honey, whatever you want. She's a teacher and very stoic and what have you. And so we did the paper, and we did all the tests she wanted. We put all the code, all the diagnosis that were, justified the test and what have you. And she goes to Quest. And it comes like 1 o'clock. We are about to close the office. Dental department, thank God, was still working until 3-something last Saturday. So they were still open. So, we were at the office still. Here she comes running through the door. What happened? Everything? We thought she forgot something. I said, is everything okay? She goes, oh my God, the kind of people at Quest and the line, and people are just waiting. And I asked this lady, and I don't mean to talk about Quest or LabCorp. What happened. It just happened like that.
It's not the same.
They provide great services, but here they go and say, you guys can draw my lab.
Oh, now she changed her mind.
I said,
right.
it's going to go to Quest anyway,
Yeah.
So she come back, and now we had to get all the tubes ready. And Oscar and the study are cracking out. They say, here she come back to us to finally get the blood test done. And we did it.
Well, but I think there's more having everything done there because they know you. They can see if all of a sudden something happened and you don't realize your face is a little bit drawn or this is gone.
Yeah,
it's like having a family.
Yeah, I had a young girl that came. She lives in Miami. And she called me and she said, I have this horrible pain on my left lower side of my abdomen. And she suffered from constipation, and she's in Miami. I said, it could be diverticulitis because it presents like appendicitis, but on the other side. I said, it could be diverticulitis. Let me call an antibiotic for you and see how you do. Call the antibiotic. I say, I'm shivering and have this fever. I'm not getting any better. I don't know what's going on. So I say, well, you need to come in then, or you got to go to the hospital. She said, I don't have insurance. I don't have a job. I'd rather come and see you. So she drove from Miami to come and see me. And we look at her, and I palpated, and left lower quadrant was very tender. And I say, let me do an ultrasound. Let's fill up your bladder with water. So she drank like 6 glasses of water. I was sitting in the waiting room. And, we go back and we do an ultrasound. And there's a condition called Mittelschmerz. It's a German guy that came this condition or diagnosis. And what happened is when the ovary is ovulating, the follicle is popping out. The follicle pop and this liquid that comes out, and it can be painful. It can even give you a little fever. So I asked her, when was your menstruation? She said, 2 weeks ago. I said, oh man, I should have asked you that over the phone. Oh, I feel so stupid. I said, man, I should have asked you that over the phone.
So
it was 2 weeks ago, and we look with the ultrasound, and she has, a couple of ovulation going on the left side and on the right side. I said, man, if anybody touch you, you're gonna have multiple kids.
Oh my goodness!
But she was ovulating, and we told her, I said, it's not normal to have that many coming at the same time. So let's go over this, and we're gonna have to hook you up with a gynecologist to see you. But we're gonna have to repeat the ultrasound probably in a week or so. So after she go through the ovulation period, when she's ready to have her menstruation, we have to look at those ovaries again. So that's the beauty of the practice that we have, that we are able to do all of that versus telling a patient, no, go to the hospital and get this done, and go over there and get that done. That we can do as much as we can. We had a patient that we sent to the hospital because he just had a history of smoker and came in complaining of abdominal pain. And he went to see the gastro, and the gastro said that he has irritable bowel syndrome. Now, the gastro is a specialist. So most doctors will say, well, if this is what the gastro say, that's what you have. And, when I'm there, I don't even want to know what the specialist says because I want to make my own mind. I don't want to be biased with my patient. I want to be able to make my judgment as a doctor. You can go and see the cardiologist, and they might say something. But what conclusion do I make? Then I can either concur with the cardiologist or not agree with what the cardiologist is saying. So that the end result is the well-being of the patient, that we are doing the right thing for that patient. So I say, let me do an abdominal ultrasound. And he has a huge aneurysm.
Oh, my heavens.
And, usually you start getting concerned about 4, around 5 or so, you want to do surgery. This guy was almost 6. And, because he's chubby, you cannot palpate it. You cannot really feel it. Even when I was doing my examination, I couldn't feel it. I put my stethoscope. I didn't hear any bruit, anything. All of the signs that we know about aneurysm, it was hard on this guy. He's so chubby that we couldn't. But I said, let's do an ultrasound, because the presentation that he gave me does not agree with irritable bowel syndrome. So I told him, the medication your gastro gave you for IBS is just the BS part. Stop it. Stop the medication. You don't need it.
That's right, but he had something more serious.
He's sending straight to the hospital. We call, the vascular surgeon.
Could have had a, right.
And he could have burst it. The aneurysm is it's like a malfunctioning balloon. You know how you blow a balloon and one side pop up?
Right.
So it's malfunctioning balloon. So it was huge.
And he was able to.
Yeah, so when I'm able to do that, and we know we saved that life, then I say, everything was worth it. everything we
That's
invested
why
on.
I think you're absolutely right. Having residents learn under you would be great. But before we do that, I want everyone to know you've been listening to Dr. Andy Mencia. And you have to read his. There's no sunrise this morning, and there's.
There is someplace.
Oh, somewhere.
Yeah,
Okay.
5 o'clock
Hawaii.
somewhere.
Somewhere. But Dr. Mencia.
I drink to that.
But Dr. Mencia is open on Saturdays.
MENCIA.
MENCIA, right. And you can go to Fort Lauderdale to see him this morning on East Commercial Boulevard, and you can call for an appointment or just go in right now. It's 954-489-1345.
Get online. Get online.
Right. Get online.
Guess what? I saw that patient. I went to Boynton Beach last week.
Yes, you said that.
And I saw the patient that listened to the show, and she went to the wrong doctor.
That's the one.
I saw her.
You saw her?
She came to see me as a patient. She came to see me as a
see
patient. So she showed me this lab. And I see the name, it's also an Italian name, but very close to the spelling of my name.
Ah, that's why.
And she said, I listened to the show, and I thought I was going to go and see you, but I went to this guy in West Palm Beach, and he did a blood test and all like that. And I said, well, you are not the guy on the radio. And he goes, no, I don't do radio.
Oh, that's it.
I'm at the wrong office then.
Wrong office. That was a funny story, but she did come, and I'm glad you saw her. So if you need home visit services, they are available for homebound patients. And Dr. Mencia is certainly everything that he sounds like on the radio, he is in person, but even better.
Oh,
thank
you.
Even better. And so you do want to do that. And the thing that I think was just pointed out and is really important is that even though sometimes there's been a different prognosis, Dr. Mencia really is very much of a diagnostician. He prides himself on that. And so if you're not getting better, you're going to some other doctor, give Dr. Mencia just the opportunity to see what's going on with you. And if you need a primary physician, I can't recommend anyone more highly. And in the article coming up in the October issue, you're going to read all about having your inoculations, your vaccines. Make sure flu, pneumonia, and shingles, right?
Right.
And so you going to have a wonderful day today?
Already started.
Yeah, it has already started. I'm sure you're going to see some
Yeah.
great patients. And I think that you are the pill that people need to take. You're the medicine. They just have to go to you. And
I have one patient that came to see me yesterday, and he said, he lives alone and he's depressed and what have you. And he said, come in here, but he didn't put it on me. He said, come in here, just talking to your staff.
Right,
I feel
they're wonderful.
so good.
Your staff are wonderful.
He said, I don't want to leave. I said, you don't have to leave. Sit over there. We'll get you some
true.
coffee.
No, you have really helped everybody to see medicine, I think, differently. And we really appreciate that in you. So I have another show we're going to, the person has not arrived, but why don't we play some commercials? We can play Dr. Mencia's commercial again. Why don't we do that?
Yeah. Go Richard. Go Richard. Go Richard.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.